Being a therapist, I know the work doesn't end when the session does. Notes, billing, scheduling, insurance follow-ups, it can all eat into your nights. That's why Katie and I use Simple Practice. Start with a 7-day free trial, then get 50% off your first 3 months. Just go to simplepractice.com.
This episode is sponsored by The Receptionist, a sign-in app company. The Receptionist for iPad is a HIPAA-ready digital check-in system that allows you to easily check in clients and take your time back. Learn more by visiting thereceptionist.com/MTSG and get your first month free.
You're listening to the Modern Therapist Survival Guide, where therapists live, breathe, and practice as human beings. To support you as a whole person and a therapist, here are your hosts, Curt Widhelm and Katie Vernoy.
Welcome back, Modern Therapists. This is the Modern Therapist Survival Guide. I'm Curt Widhelm with Katie Vernoy, and this is the podcast for therapists about the things that go on in our profession, the way that we conceptualize the work that we do with clients. And today we're tackling a topic that's maybe as controversial as it is pervasive, the troubled teen industry. It's a world where rehab often looks more like $1,000 a day boot camp and with less hugs than a Victorian boarding school. And it is something that there's maybe a scant bit of clinical evidence that sometimes really feels secondary to massive marketing budgets. And we want to have a very real conversation today about how this behavior modification system goes too far, the trauma that follows it, and how we can support people who have been through this. It's a very heavy lift, and we are joined today by Will Dobud and Chelsea Maldonado in order to be able to talk about what this actually looks like in real action. So thank you both for joining us today and sharing your perspectives.
Thank you, Curt. That was a wonderful introduction. I thought you hit the nail on the head. We could probably wrap this up. I think you did all the heavy lifting with that intro.
I second that, Will. Yeah, thanks for having us.
We're excited to get into this conversation. It's something I've been wanting to talk about for quite some time. But before we jump into the meat of the conversation, I want to ask you both the question that we ask all of our guests, which is, who are you and what are you putting out into the world?
Yeah, so my name is Chelsea Maldonado. I'm a lived experience expert and a survivor of the troubled teen industry. When I was 17, I was actually sent to an international facility called Tranquility Bay in Jamaica. And that experience really inspired me into advocacy. And so I've been researching and writing about the troubled teen industry for too many decades now. And currently, I work as a consultant and advocate with Paris Hilton's nonprofit 1111 Media Impact. And we work on both state and federal legislation around the troubled teen industry, and we also do direct advocacy. And most recently, I assisted in helping to bring back several American youths who were abandoned in the same town, actually where my facility was, at another facility called Atlantis Leadership Academy, which was shut down by the Jamaican government, and the youth were actually taken into Jamaica's child protective system. So that's a little bit about what I've been doing lately.
I guess because I've been on the podcast before talking about my angle as a therapist. I think the Chelsea and Will origin story is kind of really interesting. That we became connected. I was speaking out about wilderness therapy terms, and as many people know, I kind of grew up in wilderness therapy and as a field guide. And when in November 2022, an article came out about in The Guardian about wilderness therapy, and when I read the article, I went, "This is just direct from the industry. Like, this is all the talking points I've heard at conferences. It's safer than ever before. It's way more effective. We have a peer-reviewed open access wilderness therapy article, and by we, I don't mean me, but I mean my professional community, that has a claim that wilderness therapy is 424% more effective than treatment as usual. Like I was reading this article going, this is just an inside think piece. And I put up a thread, to use the social media buzz language, on Twitter, and I just I was just venting, like, this is a misleading point. This is incorrect. This is something like, for instance, the 424%. That's something you can only know if you speak to basically the authors of that study. Like, that's not on CNN information, you know? And what was fascinating to me is being someone that has done research where I've interviewed a lot of people who have gone to troubled teen industry programs. And when I was speaking up, some people on social media were saying, well, who the hell are you? You're advocating for outdoor therapy. You're this person that ran a nonprofit running these expeditions. And I even got called a child abuser. Like it hit me really hard where I went, oh my gosh, I think like in my professional career, I'm going quite hard. Am I not going, hard enough? And Chelsea reached out to me and we've just stayed connected from afar since then. That was the start of it. And in 2024, when in February of last year, when a 12-year-old boy died at a wilderness therapy program, less than, I think, 12 hours into the program, I sat and watched the professional community virtually say nothing, no real public statement about what had happened, and I had to write something. It was hurting me that nothing was being said. So Chelsea and I together, along with a few other academics, therapists, and survivors, wrote a open letter together to say, "Hey, enough is enough. That we're lumping all us therapists will be lumped in to the worst thing that happens. This is why Ben and Carrie's very bad therapy was so illuminating that it can happen to all of us. And so when the most egregious things can happen and nobody says anything about it, I don't know, it just felt like I'm continually getting dragged into something that I know really well, but also that I don't do. And so I felt knowing Chelsea as just an amazing badass person that walks the walk better than most of us. But it's been fun and eye opening to know Chelsea and also learn a very different perspective of that from mine as the therapist that we challenge each other a lot. So someone I consider a great person and a wonderful colleague to have.
I second all of that, Will. I am so appreciative of our friendship and the work that we've done. And I think it is so important that people from within the industry who actually understand these practices are speaking out about it. And I know that there can be a lot of resistance from survivors when that happens, which you run into kind of firsthand. But, that is how change really comes about is when, both sides of this come together and can do some meaningful advocacy and speak about it. And I think that's been really powerful work that we've done.
So if we believe the marketing, what happens with teens who are sent into the troubled youth industry is they go off to these 24-hour a day treatment programs and they get lots of therapy, and some of it's individual and some of it's group, and then they come back. What is it actually like?
In my experience, there's kind of a range of facility types. You have everything from wilderness therapy to, the more lockdown residential treatment facilities. But in almost all of these settings, this idea that kids are getting continual therapy and constant access to high quality supports is generally not the case. A lot of what is considered group therapy tends to be peer led. Most of the psychologists or psychiatrists are contracted and generally only available, sometimes once a week, once a month, only if parents pay extra. And some of these facilities don't use therapists at all. This industry kind of came out of the idea that traditional, therapeutic techniques weren't enough and these alternative methods were going to really transform people's lives. So I think we see kids subjected to more experimental or less proven ways of treating trauma and mental health issues. Some facilities, are anti-medication, so kids are taken off all their meds. Some are very pro-medication and kids are put on lots of meds. So you just have kind of a mix of experiences, but I would say that the idea that kids are getting round the clock high quality care is false.
Yeah, I would second all of that. I would add that, especially in my experience in working in wilderness therapy, that there's and Curt, you brought up like behavior modification. One of the things is there's loads of phases and terminology and buzzwords and program speak and things that like every person going through going through these programs, once you get there, you get what everybody else gets regardless. So this notion of tailoring and individualizing the care, it can happen at a very minute level. But like, for instance, and this is something I've written about previously, like in wilderness therapy, every and we're talking about a specific set of, because again, this is where I always get in trouble. We're talking about specific types of programs. And one of the things that could happen is you get there, you're instructed, do not speak to anybody until the program says you're ready. Now, what makes that therapeutic to me is like, I can't find, where did I read this in the heart and soul of change? Where did I read any of this in any kind of, you know, did Irvin Yalom tell us to make sure people don't talk to each other? Like, there's something that is inherently very experimental, as Chelsea said, but also so mechanical and rigid. And yes, there might be group therapy, every other day for 2 hours, and then individual therapy once a week. But it's the whole day to day that is really, it's so hyper structured. It's something that, like, I don't know if many therapists while we're getting our degrees and going to college would really think this is the way we should treat anybody. What happens with these organizations is actually very similar to the Rosenhan study of putting, I think it's called putting sane people in insane places and putting people without severe and persistent mental illness into a mental hospital in the 70s or 80s, I think. And what happens is once you're in a troubled teen industry program, you're never getting out for the right reason. You're getting out because you finished the program or because you did something so egregious that they're going to move you somewhere else, or your parents figured out, oh my gosh, we have to go get our child out of this place. But your letters are usually screened to your parents. You don't have open dialogue. So once you're there, you're just viewed as sick or troubled. And so there's kind of no advocate for the youth perspective at these places. That's sort of, to me, what was most troubling was I'd sit at a conference and everyone's talking about lived experience and social justice. And I'm sitting there going, but we're taking kids against their will and they're all being held an average same length of time. Like, what is individualized about any of this?
I think you made some really good points, though, about the individualization and also just the general population that tends to exist in these places. They're kind of used as a catch-all for everything from, my child is disrespectful to my child has a severe debilitating mental illness that needs immediate treatment. And everyone is grouped together and given the same treatment. And there's really there's no differentiation and there's no separation of the youth. So you often have a lot of youth on youth violence and abuse, going on as well as what's happening with the staff and the programming.
Being a fellow therapist, I know the work doesn't end when the session does. The notes, the scheduling, the billing, the insurance follow-ups, all of that admin can quietly take over your nights and weekends.
And we've both seen how the right systems can really change what private practice feels like. When we're talking with therapists who are overwhelmed, one of the biggest pain points is trying to hold too many disconnected pieces together.
That's why we want to share Simple Practice. Simple Practice is an all-in-one EHR that is HIPAA compliant, high trust certified, and built specifically for therapists.
Simple Practice is designed for the real-life complexity of private practice, helping with everyday admin that can pile up between sessions.
My favorite part? The all-in-one integration. Notes, billing, telehealth scheduling, and client communications are all connected in one spot, so I'm not bouncing around between separate systems.
And their AI scribe note taker can help make documentation more thorough and much faster, so you can spend less time catching up on notes and more time focused on your clients and your life outside of work.
Plus, if you're starting out or growing your practice, Simple Practice also offers credentialing support, which can take a big headache out of insurance enrollment.
If you're ready to simplify the business side of your practice, now is the perfect time to try Simple Practice.
Start with a 7-day free trial, then get 50% off your first 3 months.
Just go to simplepractice.com to claim the offer. Again, that's simplepractice.com. As you're talking, I'm reflecting on my experiences working in residential treatment. Just a little bit of background. I worked with younger kids in places where Child Protective Services had removed them from their families. This was a long time ago, probably 30 years ago. And then also with boys on probation. And this was all kind of, it wasn't wilderness. It felt, and it was very locked down. There was a lot of what you're talking about, Will, a lot of what you described, Chelsea. And holding that perspective of someone who thought I was doing what I could, right? I think there's a few things that I noted that I wanted to check in with the two of you about. I think the first thing is, depending on why you're there and what's going on with your family, there's all of the different things that are mixing in, the kids that are, whether it's suffering with mental illness or having a lot of trauma or loss or whatever it is, there's a lot of emotions, there's a lot of dysregulation, and the kids are really struggling. And the staff are either under or barely resourced. Usually there's understaffing, it seems like, or staff are akin to prison guards. I think there's a difference there. I was thinking I was taught how to do restraints, which are, it's a whole other, potentially a whole other conversation.
Yeah.
But there's the official way that you're taught how to do restraints, and then there's the way that the folks that have been around a long time teach you how to restrain somebody. And there's also the moments I'm remembering with some of the teens who I was teaching someone to read or having really deep conversations. And so there was those pockets of connection. But the thing that always stands out really strongly for me is how toxic the environment can feel for everyone involved. And there's not, there was times that it would get better, times it would get worse. And it seems like it's different based on what type of a residential facility, what the reason are that the kids are there, what's going on, those types of things. But I guess the question I'm trying to get to is, what are the harms that are pretty common, and why does it keep persisting? Because it seems like there's the 424% improvement or whatever it is. It seems like there's still some reason that they continue to have these types of facilities, and not all of it. I'm going to, maybe I'm a little naive, but it doesn't seem like all of it is based on just how much money and let's get kids out of the way. It seems like there is a need that's being adequately addressed. So it's kind of a broad question. So you guys take from it what you will. But I've been wanting to talk about this because I think probably, even as I was talking, I felt really, kind of emotional about my own experience of being part of, I guess, a part of this industry, which I hadn't really considered it. But as we talk about it, I'm like, yeah, I was in residential treatment. It wasn't the camps that our teen boys were sent off to, but it certainly was a place that they had to stay after they had come out of juvenile hall. So I was a cog.
I think that's not unusual. Something I've definitely noticed kind of across the board in residential treatment and wilderness is that they tend to bring in a lot of people who are in their early careers. And not only that, but the pay and benefits are often pretty low. So, the staffing, you mentioned understaffing, that is a really common, problem even today in pretty much every facility type for that reason. So I think most of the people who enter this industry as staff are doing so with good intentions, but, they don't have the training and the support once they reach these facilities. And as you said, you become kind of a cog in something that doesn't align with what your original goals were. You asked kind of about the most common harms that we see, and you did touch on one of those, and that is restraints. Physical restraints in these facilities are incredibly common. They are often used in a punitive way, not, simply for crisis management. And a lot of the restraint methods that are employed in reality versus what's shown, in the manuals are dangerous. And so we've seen multiple deaths in facilities caused directly by restraints. Cornelius Frederick in 2020 was actually killed during a restraint at Lakeside Academy in Michigan, which is a residential treatment facility that primarily focused on foster youth and former juvenile justice children. He was held down by multiple staff for throwing a sandwich and eventually suffocated to death and went into a coma and passed away. And this is not, unfortunately, unusual. I have had to pull together lists as part of my work, and there are hundreds of these cases in facilities around the country. We also see a lot of injuries from that as well. I think the prolonged separation from family is particularly traumatic, not being able to freely contact anyone without your phone calls or letters being monitored. We see a lot of medical neglect in these facilities. So kids are kind of automatically considered liars when they enter. And any attempt to go to the doctor or get treatment or opt out of an activity is considered manipulative or faking. So there's been deaths from that as well. There was a girl who died from a perforated intestine who was just given Pepto-Bismol for weeks until she passed away. And she was called a faker in her facility as well. On top of that, there's a lot of sexual abuse that's occurring both between the youth and often between staff and youth. Many of these facilities are hiring people that are only a couple of years older than, the people they're in charge of. And that can create some kind of blurry lines. And they also often employ former students, which again kind of blurs the lines between student and staff. So those are some of the things that stick out to me. Well, you probably have more to add from the wilderness side, especially.
One of the things I think I can speak from being an early career person in there is I did look up to just about everyone I worked with. It was the first time I was around adults that talked about feelings, and I just thought, oh my gosh, like this is so different and amazing. And the second I worked in outpatient, I went, oh, I have not been trained in anything, how to engage people, I've been trained to read self-help books and talk about them with young people. Like, I was like, this is so not as sophisticated as it seems on paper. Now, I think I had a protective factor of being quite oppositional myself. I didn't like being told what to do. So, like, learning restraints, I was like, yeah, I'll learn that. And then whatever, I'm not doing that. So, and I think this is a side of the story that I've said a lot recently, that for how, especially in the US, for how much we have talked about social justice over the last decade and human rights and oppression, how this story is not on mainstream news every single day doesn't add up for me. Before we hit record, I was telling you I had access to a research database of nearly 7,000 young people who had gone to wilderness therapy program. All I had to do was, it's a big spreadsheet, and it's way too big, and statistics people better than me, they did the statistics voodoo that they do to it. But all you have to do is type in gay, sexual orientation. And what we see are these programs that are designed to fix your child, written in therapy language, that look a lot like conversion therapy. As we said, 25 to 30% of young people going to any time, not just wilderness, but in residential care, are adopted youth. So there's this really sad narrative of, first off, why are we fixing this many adopted youth? Like the whole thing is this fixing. And I know that Curt, Katie, and I, like, having gone to study how to become a psychotherapist, we learn a lot about power. And then for some reason, we all hear things, do your best to reduce the power imbalance and try to be as equal as you can. And we know that's impossible. But there's something about working at these places and the experience of the young people I've spoken with that staff really don't, not only just, they just ignore the power that they have. It's like they're getting more out of their career from thinking about how much power I have, how impactful I was in saving this child's life, how important I am in the role. And what that leads to is really just not thinking, and I'm being really generalizing here, but not thinking about how much power we have in any therapeutic interaction that we have. Like, I'll see someone later today. My office door will be shut. They will be alone in a room with me. I will have all the power. It doesn't matter how nice I am. And so there is this icky thing that has happened where these organizations and programs, and even the word programming is bizarre in the therapeutic world, that these kids don't choose to be there and don't choose the adults that are around them, and no one's sitting around thinking about power. And that to me has been just a total blind spot in our social justice movement with youth. And I know that when it comes to aged care, the older you get, the more you get treated like shit anyway. And the younger you get, the more you get treated like shit. And so it's been I think that there is this issue of when people don't receive the training on thinking about power and what that really means as a therapist or as a shitty outdoor guide or as just someone who does care for youth, but you want to you want to be the good part of the system, which we hear a lot of. But if we don't acknowledge power, it's a very slippery slope to this all going the wrong way.
Your time is valuable. Whether you're hyper-focused on admin tasks like billing or simply trying to make a cup of coffee between appointments, constant interruptions can derail your entire day.
This episode is sponsored by The Receptionist, a sign-in app company. The Receptionist for iPad is a HIPAA-ready digital check-in system that eliminates the need to walk back and forth from your office to the waiting room to see if your next appointment has arrived. Clients and patients can securely check in for their appointments, and you'll be immediately notified by text, email, or your preferred channel. Break free from interruptions and make the most of your time.
Start a 14-day free trial of The Receptionist for iPad by going to thereceptionist.com/MTSG. Make sure to start your trial with that link, and you'll also get your first month free if you decide to sign up.
Now, you asked another question, Katie, that I wanted to ask back to Chelsea, which is, how the heck does this keep happening? How has this not changed? Why haven't we seen progress at all? So, Chelsea, I'm passing back to you.
Awesome. So I think there's kind of a few different channels for why these facilities still exist. Right now, probably one of the biggest reasons is that we have a massive shortage of appropriate foster care settings across the country. And so a lot of these facilities are currently being used to house foster youth because we just don't have any other beds. And so many states are reluctant to take big steps to regulate or to close these facilities because they don't have alternatives for where to place youth. So there is that. Will mentioned the number of adopted youth in facilities, and that is something, that I think needs to really be looked at. Many of these places are advertising directly to reactive attachment disorder, and a lot of parents who have adopted youth, especially out of foster care or youth that have a lot of trauma, when that becomes difficult, these become tempting options, and these facilities kind of promise change and lure parents in that way. There's a facility operating in Jamaica right now called Youth the Vision Academy that focuses entirely on adopted youth, starting at age 7, I believe, and has about 250 kids right now, many of whom are spending multiple years there. So that is a big issue. And then I think in terms of parents, there are a lot of dysfunctional families out there. And this industry provides kind of a promise that we can undo the harm of family trauma just by fixing your kid. So if you send your kid to us, we will be able to reverse everything that's happened in your household and send them back to you compliant and loving and appreciative of you, kind of no matter what has happened. I think that's kind of the most common reason that these programs are used. And that is, in my experience of being part of the industry and working with survivors all the time, really what I hear the most. I had conflict at home. my parents chose a program. I stayed there until I either graduated or they felt I was compliant enough to come home. And, you know, it doesn't actually lead to lasting change or family repair. In most cases, I think it creates a permanent rift. I was a little wordy, but
Well, there's so much there, and there's a thought that's been coming to my mind since Will was talking about, workers not recognizing power, and then you used the word attachment, and that was what was ringing in my head, is that there's also not a consideration around attachment. We've got young kids, youth, teens that are basically being cared for by adults that range from, security guard to bleeding heart, that's kind of where I put myself. Is I would come in and I would sit and talk with them, and I'd try to have these relationships with them, but I was only on 40 hours a week, maybe 50 if I was wanting to get overtime. And at certain points, I was required to restrain folks, and that was the only physical contact they got from the adults around them. And it feels like not only are you not healing a family attachment issue or a family trauma, you're creating all these additional attachment wounds that are not. I don't even know how to I can't continue that sentence. It's so awful.
Well, I think the way we're trained to interact with youth at these places doesn't actually translate to virtually anything we learn from the textbooks. So
Yeah.
even things around, touch or even professional boundaries, right? These are kids where they're living somewhere, and then we're told, "Oh, when it's dinner time, you can go and take a break," and it's like that's not how households work.
Yeah.
So we've put kids into this institutionalized setting and then used therapy speak and kind of buzzwords of boundaries, professionalism, restraint as their techniques. And to the child, it's like, where are the caring adults? And we'd never, if we ever, this is like, I think a big question, and this is probably where Chelsea and I probably really align, that some of the organizations, when they reach out, like for instance, one wilderness therapy program called me and said, you have to help us. You have to help us get better. And I said to them, well, they said, we'll pay you and you can be a consultant for us and help us get better. And I said, no way. And I said, because I'm going to take your money and then I'm going to be annoyed at how little your organization wants to change. That doesn't mean individuals there want to make a change. But as a system, this organization is not changing to what my liking is. And what has to happen is if we all said, let's start over, and we need a place where kids, for instance, Katie, in your experience, exiting detention, we need a place that we can put these kids. We would all never create what is created right now.
Yeah.
So the question we always get asked is reform possible? I don't know. Like, there's licensed therapists at all these places. Where's our professional associations? Where that boy died, nearly 2 years ago, that's Joint Commission, state licensed, accredited by the professional associations with licensed therapists, psychologists, social workers, MFTs. Who actually has the teeth to protect these kids? I don't know what that answer is. So it is really hard because if you do want to be someone to go into these places, it can just be soul destroying. And there's research where it's like burnout among these staff is really high. And it's like, well, no kidding. It's hurting the kids. And then you have to be around it. And that's not why you got into this role. I don't know, Chelsea, if you wanted to add to that.
no, I think those are all really valid points. Just kind of looping back to the attachment piece and kind of what you were speaking about earlier. There's so many limitations too on how the children are allowed to interact with each other. So in my facility, we weren't allowed to speak to each other until we reached a certain level. There was no amount of physical contact ever allowed. So you could not hug each other, someone was crying. And most of these facilities use something called positive peer culture, which is kind of what that level system is based on. And it really relies on us kind of telling on each other and reporting each other for infractions. And it creates this very adversarial dynamic and confrontational dynamic that would not function in the real world. And that is not something that is beneficial once you get out. Most people don't want to be confronted all the time with feedback and, asked to change their behaviors in really direct ways. So I think it also creates attachment issues between the youth, and it creates, social issues when people return to society, because the skills that you're learning in these really closed environments don't translate to normal life. And so people really struggle. And I think also, to Will's point, the fact that this trauma is occurring in front of so many therapists, and that so many of us were referred in one way or another through therapists, means that when we get out, very few of us are likely to seek therapy again. And so this community as a whole is highly therapy resistant, but highly traumatized. And so, there's a real need for therapists who understand institutional abuse and the troubled teen industry to kind of make themselves known and create safe spaces for survivors to talk about these issues.
Are there any programs at higher levels of care that are actually effective in treatment?
I think that short-term crisis intervention, in a true hospital setting can be appropriate when someone is in crisis. I don't think that there is evidence supporting long-term placement in residential treatment centers. I don't think that that is generally an appropriate way to handle most things. People do better in their communities. They do better when they have access to community-based mental health services, their families, their friends, their supports. So spending multiple years in a lockdown institution is rarely helpful or beneficial to anyone, in my opinion.
I know for myself, one of the iterations and I guess evolutions I made was moving into community mental health and working in programs that kept kids with their families and out of treatment and or these residential facilities and being removed from their homes. And I think that there are places and programs, I know you don't like that word, well, but there are types of interventions that do try to focus on that, and there's been some of that, but I've been out of that, even that arena, for a very long time. And so when we're looking at kids who are really struggling, that are in the past might have been candidates for these types of treatments, it sounds like, Chelsea, you're saying short-term crisis intervention. What are the things that the two of you are saying for that deeper, longer work that maybe needs to happen to support kids who are really struggling?
Well, I think when it comes to therapy, I mean, I'm sure that we've all talked about this before, that we have in the mental health world, in the therapy world, we have an engagement problem. The modal number of sessions young people go to is one. They drop out prematurely more than any other clientele, no matter how we shake the data. So the solution to that isn't holding them against their will and forcing this sort of compliant engagement in something that, like even just from a meaning-making perspective, the amount of young people that Chelsea and I have spoken to who say, I just had to play along to get out of there. Like, that's not good therapy at all. So at the end of the day, and this is why feedback-informed treatment changed my world, at the end of the day, one of the most important things is, are you helping your client in a way that the client thinks this matters? And if not, are you going to make them keep wasting their time with you? Because that's likely to hurt them the more that we are ineffective with them. So the notion, and as I mean, this is another buzzword of the day, like, all of these organizations all say they're trauma informed. They're all talking about attachment on their websites. They're all talking about trauma. And then, but really, a trauma informed agency has to allow people to make choices. Trauma is a taking away of agency and taking away of choice. How can we have therapeutic services that are inherently about, you're not in a right place to make a choice? So that's where the institutionalization is such it's a dangerous slippery slope. And I think that is where this industry is set up in a way that it makes it really tricky, but we do have to go back to basics with kids. I mean, success, mastery, good relationship, strong connection, having fun, playing. Like these things are so much more important than whether or not you're in a facility or not. And I don't want to discount any family that's really struggling or a therapist that is a really distressed young person. It's just that the factors of these industry organizations actually are all, operationalizing factors that none of us would ever be trained as this is good therapy anymore. And sometimes we get, talked to about calling it an industry and why is that the right term? And I will say that the state of Utah is very concerned about the number of their programs that are closing because of the industry and how much money it brings into the state of people coming in. I mean, Utah is just a pocket for so many of these programs. And so being concerned about the state's tourism, these are all things that we see online that if these programs keep closing, what about all these employees? What about it's like, wait a second. Like, why are we protecting the industry more than the young people that we're all trying to serve?
I know we're getting pretty long on time, but before we finish up, I'd really love to hear more about the work that you're doing, Chelsea, and how survivors are working to impact change, the recent incidents you've witnessed, those types of things. If you can give us a little bit more information on how we can support the work that you're doing.
Yeah, thank you. So yeah, the survivor movement, has been going pretty strong for several decades. In 2020, Paris Hilton came forward with her story of being a troubled teen industry survivor and released a documentary on YouTube. And that really kind of brought this issue back into the media limelight. We have used that to kind of continue to bring awareness to the industry through the media. And we are also trying to pass both state and federal legislation. We did pass the Stop Institutional Child Abuse Act last year, which sets up kind of data collection at the federal level, which seems small, but we are actually not collecting data on these facilities or what's happening to the children inside of them. So that is a good start. And then we also do direct advocacy, from time to time with survivors. So I mentioned Atlantis Leadership Academy. That was a small troubled teen industry program operating in Jamaica, where some of the most horrific abuse that I have personally heard about was occurring. These youth were beaten regularly, waterboarded, kept awake for 5 to 7 days, subjected to just literal torture. And the embassy and Jamaica's Child Protective Services actually stepped in and closed the program and took the youth into CPFSA custody. What we saw then is what's most disturbing. Not a single parent actually wanted to come and get their kid back immediately. The program was so convincing in its marketing to parents that they believed that every single child was lying about the abuse, that CPFSA was corrupt in making it up, and that the embassy was also lying. I ended up getting involved because one of the boys' mothers actually reached out to me through a survivor group just to kind of ask some questions. And she shared these handwritten statements with me that the boys had sent to her, and they were just absolutely devastating. And I was able to mobilize several attorneys and Paris's team, and we went to Jamaica and actually advocated to get these youth back to the United States. But what really stands out to me about that is it wasn't our government that brought them back. It wasn't CPS. It wasn't, the people who are supposed to be doing this job. It was literal survivors who had to mobilize and travel and, take action to bring awareness to this before anything actually changed. Thankfully, all of the boys are back in the United States now, but this is something that is happening all over the world. There are facilities operating in Mexico, Costa Rica. Just it's a scary time right now. So that's kind of what I've been working on most. And then one thing I just want to shout out, which I didn't do myself, but there is a therapist in Michigan, Deirdre Myers, who actually released what I think is the first therapeutic workbook for survivors of the troubled teen industry. And that is called Reclaiming Strength, a healing workbook for survivors of the troubled teen industry. And I just want to shout that out as a resource for therapists who might be wanting to work with survivors, because I think it's a really great tool.
Will, where can people find out more about the work that you are doing?
Sure. My name is very unique, so willdobud.com, or you can search that pretty much anywhere, and there's not another one in the world as far as I know of, so you can find what I've written or on social media. I try to remain somewhat active on social media, so you can find me on any of the socials as well.
Chelsea, where can people find out the work that you are doing and supporting you in the work that you would like everybody in our industry to follow up on?
Yeah, so 1111mediaimpact.com talks about the nonprofit that I do consulting with, and all of our campaigns around the troubled teen industry and that kind of advocacy are available there. I can also be found on Twitter, Yep for Rights. That's probably the most active place for me.
We will include links to all of these in our show notes over at mtsgpodcast.com, and well as some other of the occasional things that pop up in the past of the media. So that way you can see that this is not the only conversation, and hopefully to be able to steer some sort of action to be able to do this, whether it be in the way that you conceptualize all of our treatments and the way that our entire therapy ecosystem ends up supporting programs like this, even inadvertently. So follow us on our social media, see our show notes over at mtsgpodcast.com, and continue on with this conversation in our Facebook group, the Modern Therapist Group. And until next time, I'm Curt with Katie Vernoy, Will Dobud, and Chelsea Maldonado.
Private practice has enough built-in complexity. Simple Practice brings notes, billing, scheduling, telehealth, insurance, and client communication into one place. Start with a 7-day free trial, then get 50% off your first 3 months. Just go to simplepractice.com.
With the receptionist for iPad, there's no more walking back and forth to check the waiting room for your next appointment. Receive an instant notification that your next client has arrived, securely and privately. Visit thereceptionist.com/mtsg and get your first month free.
Thank you for listening to the Modern Therapist Survival Guide. Learn more about who we are and what we do at mtsgpodcast.com. You can also join us on Facebook and Twitter. And please don't forget to subscribe so you don't miss any of our episodes.